Hey everyone, welcome to this audio podcast in the series, the Rogue Storm episode. This is the Shientist, and this audio podcast today will be about the use of plasma products. Um, and once again, this is another Storm Lipostics production. So a bit of introduction. Plasma is a non-cellular straw sort of colored fluid portion of anticoagulated whole blood that can be observed after whole blood is allowed to settle. Chemically, plasma comprises of water, electronic ions such as sodium and potassium, and other proteins, and the soluble plasma proteins are primarily albumin, globulin, and coagulation factors. And presently, human donor plasma is sort of the raw material for the production of numerous diagnostic and therapeutic products, in addition to those most often associated in transfusion laboratories and blood banks. And in line with this, the uh, the um, um, the sort of the raw products that can be identified in relating to plasma or plasma products are cryoprecipitate, fresh frozen plasma, um, and human albumin solution. Uh, Fresh frozen plasma, or FFP, is the fluid portion of a single unit of blood that has been sort of centrifuged and separated and frozen at minus 30 degrees, 30 degrees or colder within 8 hours of collection from a donor. FFP, fresh frozen plasma, contains labile and stable components of the coagulation, fibrinolytic, and complement systems, proteins that maintain osmotic pressure and immunity, and also other proteins with diverse activity, and also fats, carbohydrates, and minerals in concentrations similar to those in circulation. Now, a little bit around the sort of definite indications of fresh frozen plasma. So, a replacement of single coagulation factor deficiencies where a specific or combined factor concentrate is unavailable, and also where there's immediate reversal of warfarin or anticoagulant effect, and also where there's evidence where individuals or patients have disseminated intravascular coagulation or DIC, and also a hematological condition known as thrombocytopenic purpura or TTP. In relating to sort of pediatrics and neonates as well, fresh frozen plasma for neonatal use is obtained by a process referred to as apheresis of a donor not previously who might be not previously pregnant or transfused, and also negative for red cell antibodies, and then treated with methylene blue. And in relating to fresh frozen plasma and specific conditional uses, um, uh, uh, this can include massive where there's massive hemorrhage or transfusion requirement, liver disease, cardiopulmonary bypass surgery, special pediatric indications, and where there's no justification for the use of fresh frozen plasma. This is where there's hypovolemia, and as mentioned in a previous audio podcast, fresh frozen plasma in a hypovolemic state, in hypovolemic sort of conditions, cannot and do not on their own have any sort of potency or efficacious sort of value in solo versus for example red blood cells. Plasma where for example where there's plasma exchange procedures, and there's no justification for use of fresh frozen plasma as a formula replacement, and also in related to nutritional support and the treatment of immunodeficiency states. In relating to fresh frozen plasma and its availability, adult packs of a single volume of 300 ml each available are available in all typical ABO blood groups, overwhelmingly more so from male donors versus female donors. Group AB fresh frozen plasma deficient in IgA, immunoglobulin A, is available by request, but normally as a request through, for example, hematology consultants or senior laboratory sort of practitioners. And also pediatric packs of 50 ml are available also normally through blood services in all blood groups, and so thus in all blood groups, thus in ABO in and around ABO compatibility. In relating to storage conditions, fresh frozen plasma must be stored at -30 degrees or colder for a maximum of up to 12 months. Once thawed, fresh frozen plasma must be stored at room temperature and must not be refrozen, and also has to be and should be used within 4 hours of being thawed out. And fresh frozen plasma can be issued in the following particular situations as well. So where there's documented abnormal clotting with bleeding, or a preoperative case when, for example, the international normalized ratio is over 1.5 or prothrombin time is more than 15 seconds, and where in this case, in relating to this, one of the indications is to give to issue 300 to 600 mils or more, depending on patient's weight, and it should not be issued more than 4 hours before any surgical procedure in that regard. And if requested by intensive care unit consultant or specialist, and also in an ongoing or anticipated massive transfusion. And so, for example, where there's over 10 units of blood in 12 hours and a volume of 300 to 600 mil, fresh frozen plasma may be issued, and more subsequently according to the clotting screen and patient's weight. And also fresh frozen plasma can be issued in relating to pediatric patients, where there's a request for an infant or infants with coagulopathy. Before issuing, patients on warfarin who require emergency surgical intervention or have life-threatening hemorrhage must be investigated or understood. And then any situation any situation that has not been sort of covered above must also be investigated before issuing fresh frozen plasma. Also, in relating to fresh frozen plasma before its use, and the heat sealed fresh frozen plasma provided is provided in a heat sealed bag minus the box, and must be placed in a plasma thawing water bath at 37 degrees. And it is essential that the bag actually containing the fresh frozen plasma does not come into contact with the water. So when the fresh frozen plasma has been thawed out, the outer bag is wiped dry, and only then is the bag actually containing the fresh frozen plasma removed. Fresh frozen plasma can also be thawed in a suitably controlled alarmed microwave oven, and most transfusion laboratories will have a sort of microwave oven for particular uses in preparing blood components where patients on particular wards may need blood components in a hurry. Fresh frozen plasma can be thawed out if there isn't for example, a water bath facility within a transfusion laboratory. Before issue, fresh frozen plasma can contain red cell stroma, and D-positive fresh frozen plasma is unlikely to have sufficient stroma present to cause a primary stimulation of anti-D, but may cause a secondary response. In this slide, or in this table, on this table, I've highlighted an overview of how fresh frozen plasma should be issued by particular ABO blood group. I won't provide any particular in-depth detail. The table here, or in this slide, on this overview is available for reference and referring. In relating to how fresh frozen plasma is packaged, currently the fresh frozen plasma is packaged in can be packaged in various forms, but eventually all plasma will be in an outer heat sealed bag, and then placed in a particular individual box. In relating to standardized practice or standard operating procedure, once thawed out, the time of thawing must be written on the bag, a bag label, documented and labeled for the patient, and issued where appropriate. And that concludes this audio podcast in relating to the use of plasma products. This slide provides a general overview of references and acknowledgements. And in this audio podcast series, we've covered pathology automation, massive transfusion regimes, pediatric transfusion, pre-transfusion testing, the provision of blood for bone marrow transplant patients, and the use of plasma products. The final audio podcast in this particular series on the SZtorm episode will surround thrombophilia, once again, I've been your host, the Shientist, and this is audio podcast surrounding the SZtorm episode, and this has been another Storm Robotics production. Thanks for tuning in.